On Monday, Trinidad and Tobago received a donation of 43,200 Pfizer COVID-19 pediatric vaccines to inoculate children of the 5 to 11 age group from Spain. And according to the Embassy of Spain, our country is the first in the Caribbean to receive this type of vaccine. With me to speak more about this is the Minister of Health, Minister Terrence Deyalsingh. Mr. Deyalsingh, good morning. Thank you so much for joining us on Now.
Good morning, Kimberly, and good morning to all your listeners and viewers, wherever they are. Good morning.
Now, Minister, after a long journey from Spain, the pediatric vaccines are finally here. Has the ministry established a rollout plan? I think I saw a press release yesterday stating it's going to begin on Wednesday.
Yes, so the rollout plan starts tomorrow. We normally start 2 working days after receipt of vaccines, so that is tomorrow. We have expanded the number of sites. We are going to be doing these in about 30 sites. So a press release did go out yesterday. There will be an ad in the papers tomorrow. So it will be available at some of the health centers and the usual mass vac sites that people have grown accustomed to over the past year and change. So it's going to be widely available.
And what do parents need to bring with them at the vaccination sites?
Yeah. So the child, 5 to 11, must be accompanied by an adult or guardian. Bring your birth certificate, and that's about it. Not your birth certificate for the child, right? Because you must give parental consent. It's the same formula we use for the 12 to 18s.
Nice. So you said that the mass vac sites and some of the health centers, but of course you're going to be putting that release in the papers today.
Yes, it is. It is there, and it's going to be in the papers again tomorrow. And I will go it through tomorrow in detail at our usual 11 a.m. press conference.
All right. Now, Minister, what sort of vaccination strategy will the ministry be using? Because, of course, we have seen a dip in numbers. So how will we encourage parents to bring their children out for this type of vaccine?
Well, we have given parents all the information that they need to get their to get their kids vaccinated. We do have cases in schools. It's not a cause for alarm at this point in time, but we can mitigate further cases in schools if we start to get more of about 12 to 18s vaccinated and also now 5 to 11. Because the worst thing you want to do, Kimberly, is to keep children away from school. It is not good for their long-term social development, educational development, mental development, and their overall health. We must keep our schools open, and vaccinations is one of the ways to do it.
Now, Minister, as you mentioned, the school, with the introduction of the pediatric vaccines and knowing that we also have the vaccines for that over 12 age group, do we anticipate a decrease in numbers at schools?
A decrease in numbers?
In COVID cases?
Well, we would like to think so. But remember, even with the 12 to 18, we only have about 60% of them vaccinated because too many parents have bought into the anti-vaxxers message. And it's a global problem, but we just ask parents to believe in the science, trust in the science. The anti-vaxxers do not have your best interest at heart, do not have the best interest of the country and your children at heart. We do.
Now, Minister, for the anti-vaxxers or those adults who may still be on the fence, do you think the introduction of these vaccines may encourage them to go out themselves and get vaccinated?
We hope so. We hope so. We are not giving up on vaccinating as many people as possible. We hope that with time, as all the data comes in to show that vaccines are safe, vaccines are effective. Look, one of the reasons we can open up the economy now is because 50% of the population is vaccinated. The vaccination has helped us get back to an almost state of normalcy. And this is around the world where vaccination rates are helping us get back to normalcy. So we just ask people to pay attention to the facts and not to believe the conspiracy theories of the anti-vaxxers. They are not working in your best interest.
Minister, with the rollout that's scheduled to begin tomorrow, do you anticipate large numbers coming at the sites?
Well, let me put it to you this way. When we rolled out the 12 to 18 at the height of the Gamma variant, where there was a lot of concern, there was a lot of demand for vaccinations. The first couple of days, we did 3,005 per day. We don't anticipate those numbers because now the Omicron variant is at hand, which is a much milder variant. The economy is fairly open. When we did the 12 to 18s, things were not, we were in a state of emergency, so circumstances have changed. But we welcome everyone. That is why we have expanded it to the number of sites so that parents and these little kids don't have to wait and get anxious, because that is the main thing we noticed with the 12 to 18. Not that the vaccines were causing mass side effects. There were 1 or 2 cases of inflammation, but most of the cases were due to anxiety. And we want to decrease that anxiety level by opening up and having many more sites so kids don't have to wait long. The longer you have them waiting, the more anxious they and their parents become.
Now, Minister, as you mentioned, the opening of sites, we also have all the other vaccinations happening, right? We have the adults, we have the 12 to 18. We've also introduced the booster shots and the second booster shot for that immunocompromised group. I mean, with all these vaccinations happening, do we have enough healthcare workers on the ground to manage the numbers that we'll be seeing?
Yeah, so the numbers that we are seeing now are pretty small as compared to the height of the vaccination program. At the height of the vaccination program, our best day was 16,000 shots a day. Now we are down to under 1,000. So to answer your question, we have more than enough staff to do what we are attempting to do.
Minister, one of the things that the Embassy of Spain would have announced is that we are the first in the Caribbean to receive this type of vaccine. I mean, what was the criteria for us being the first with this one?
Well, I can't say what was the criteria. What I know is that we worked tremendously hard. Kimberly, the public will never know how hard it is to acquire vaccines behind the scenes. And I never spoke about the fact that we are going to be the first CARICOM country to roll out this vaccine, because you hear a lot of ill-advised talk, especially from the opposition, when the vaccines come in. It is not as simple as that. Imagine a year and a half into a vaccination program, these vaccines are still not available commercially. They are only available to governments. And the population will never know how difficult it is. We have to work behind the scenes to acquire these vaccines. And I am proud that we at the Ministry of Health work very, very hard with the folks at the Embassy of Spain. And I must thank His Excellency, the Ambassador, his technocrats there who worked with us, and also the people of the Kingdom of Spain for making this donation and working so hard. It's a lot of work, Kimberly. It's a lot of work to bring vaccines into this country at a governmental level. You would not believe the amount of paperwork, the amount of agreements, the back and forth to bring in any vaccine for people into this country. It is a logistical challenge that we have never done in the history of this country. And I'm very proud that today, as the ambassador said, we are going to be the first country to start to administer this vaccine to the 5 to 11 age group.
Now, Minister, as we look forward to the new school term, I believe it is still in place that to enter school, at least at the age of 5, you need to get the MMR vaccines, right? The measles, mumps, rubella, as part of the schedule to enter school. Do you know if this vaccine will also be included on that schedule as we look forward to the new school term?
No, as the Honorable Prime Minister has stated publicly, the COVID vaccine will not be included in the schedule. So this is optional, it is voluntary, it is not mandatory.
Nice. Now, Minister, I'm going to shift gears a bit to monkeypox, which,
sure,
of course, we have a lot of cases in the U.S., in the U.K. I heard you mention Minister, why are you laughing?
No, it's one disaster after another, isn't it?
It is. It really is. But I have to get your thoughts because it's in the U.S. Oh. I think this morning I heard it was in Miami, right? And of course, it is becoming a concern to us in the region. I mean, what is the ministry doing as a sort of plan to mitigate that entering our shores?
Yeah. So as I say, it's one disaster after another. Yeah. So monkeypox is a viral infection that is spread mainly by very close physical, prolonged physical contact between people or surfaces that an infected person contaminated, like bed sheeting, pillows, clothes, and then you go on that bed sheet, you wear those same clothes, and so on. So it is a difficult vaccine to transmit. What is absolutely scientifically curious about this outbreak is the first time you are seeing multiple cases in multiple countries that the individuals don't have a travel history to Africa, to Central Africa and West Africa, where the monkeypox is more or less endemic. So that is baffling scientists. It's the first time you are seeing these small clusters in so many countries at the same time. Even though the numbers are small, it is a cause of concern. It is a cause of epidemiological investigation right now to find out if this is due to a change in the behavior of the virus or a change in the behavior of people or a combination of both. So what we are doing in Trinidad and Tobago, one, we have stepped up our airport surveillance. Two, we are working with CARFA to develop testing capacity for the CARICOM region. Three, we are working with the University of the West Indies to develop genomic sequencing capacity. Because like COVID, you want to know the exact nature of the virus you are dealing with. We have alerted all RHAs about their case management, how to detect a suspect case, how to isolate, how to treat. So we are doing all of those things as mitigation strategies. In addition, as I started to indicate in the House yesterday, we are also in the market for a vaccine called JYNNEOS, which in 2013, I believe, was approved for use in the United States. So it's a vaccination that is effective against both smallpox and monkeypox. If we get the vaccines, the current strategy for vaccination is not a wholesale COVID-19-like vaccination program for the entire population. It is more or less targeted to close contacts of any suspect case or positive case. So if, for example, I come down with it, you don't vaccinate the whole country. You vaccinate my immediate family, my immediate friends who I have contact with. So small concentric circles of vaccinations radiating out. You vaccinate the initial contacts. We are also in the market for antiviral drug, and let me just go into my phone to get the correct name. The antiviral drug is called tecovirimat. We are in the market for that drug, just like how we have antivirals for the cold and for H1N1. So we are exploring all avenues locally and internationally for mitigation strategies, for vaccination strategies, and for antiviral treatment strategies. But the first mitigation strategy is an informed, educated, and updated public. And that's why we sent out the press release on Friday, giving them the hyperlink to PAHO's website, where people can see the countries affected, so that if you know you have been in contact with somebody who recently traveled to any one of those countries, you need to be aware and take the necessary precautions.
Good. Now, Minister, going back to vaccines, because we only have a few more minutes left, the booster program, can you just give us some details on that? Is it that the first booster is continuing alongside the second booster as well?
Yeah. So the entire vaccination program is afoot, entire. First dose, second dose, first booster, second booster, 12 to 18, and now from tomorrow, 5 to 11. So the whole gamut of the vaccination range is afoot, and we ask the population to take advantage of it. The more people we get vaccinated, the more normalcy we can have in Trinidad and Tobago. Economic normalcy, social normalcy is good for your mental health, is good for your physical health, as people get back out to play, to work, and engage in their social lives.
And Minister, of course, going back to the pediatric vaccines, there may be some parents who, for example, may not have all the documents. So if they don't have the children's birth certificate, for example, can they still come down to get them vaccinated?
We would prefer that because we need proof of age, but I will leave that up to discretion of the individual sites. I mean, you can look at a child and know that they're 5 or 6, but we don't want to be vaccinated children under 5 because you may have a 4-year-old who looks like 5, and that could lead to a whole suite of problems. So we ask you to get your birth certificate. Everybody should have a birth certificate, especially a school-age child. You need it to get into school. So you need the proper documentation because there are legal consequences.
And Minister, finally, for now, you're encouraging parents to come to the vaccination sites with their children. But will the ministry ever develop a plan to go in schools to begin vaccinated children as well?
For the time being, we want to stick to the mass vac sites. We did have a school outreach program about 2 months ago. It was an abject failure because the numbers were simply too small. Parents did not bring them out in any numbers to make it worthwhile for us. So let's stick to the 30s. We have made it as easy as possible. There's a site as close as possible to all major towns, villages. Your health centers are easily accessible, and the list is being published as we speak.
And Minister, for those wanting more information on where they can go to take their children to get vaccinated, any info on that?
Yeah, so we are going to be publishing that today. It will be on the Ministry of Health's website, so take advantage of that. Press release did go out last night, listing all 30-something sites. There will be an ad in the papers tomorrow. So there is a lot of source information and resources that people can go, but you can look at the Ministry of Health's website.
Minister Deyalsingh, it's always a pleasure. Thank you so much for joining us on Now.
Thank you. Good day all. Have a wonderful day.
You too. And that was the Minister of Health, Terrence Deyalsingh, just giving us some updates on the COVID-19 Pfizer pediatric vaccines, that donation that we got from Spain, where you can go to get your children vaccinated. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.